I'm here at the headquarters of the United Nations, which houses the World Health Organization in Geneva, Switzerland. This is where we'll be bringing you this week's edition of Health News. Thank you so much for joining us. I am Jomi. In less than 30 minutes, I'll take you through the one-week deliberations of over 2,000 delegates from about 194 countries attending the 67th World Health Assembly meeting, the decision-making body of the World Health Organization. It was a full hall for the opening ceremony. Delegates from Africa joined others in a meeting where decisions that promote health and ease the burden of global diseases are taken. At the helm of affairs here is the Director General of the World Health Organization, Dr. Margret Chan. She opens the floodgate for discussions.
WHO constantly monitors evolving trends and sounds the alarm when needed. For communicable diseases, one of the most alarming crises is the rise of antimicrobial resistance, AMR, which WHO documented in a recent report launched last month. This is a crisis that now affects every region of the world, and it is only getting worse. The new report on adolescent health is another alert to neglected needs. WHO takes up the cause for orphan problems and gives them a home, arguing for similar attention to regulatory capacity. Countries must have well-functioning regulatory authorities to protect their populations, whether from tainted food, unsafe medical products, tobacco, drink driving, air pollution, notifiable infectious diseases, or the marketing of unhealthy foods and beverages to children. Countries also need well-functioning information systems. The new accountability frameworks for results-driven initiatives depend on reliable information.
Considerable progress has been made towards reaching the targets for the health-related Millennium Development Goals. This has resulted in significant health gains, notwithstanding the reality that many of the targets will not be fully realized by 2015. We have, over the last decades, generated a wealth of experience and gains that should not be lost as we better position health in the coming years. For example, through the expanded program on immunizations, most of the countries in our region have successfully implemented strategies that have achieved coverage of at least 80% for antigens such as DPT-3. The African region's position is clear on the way forward, in that health should remain central to the framework for sustainable development.
It is frightening to think that of the estimated 800,000 people trafficked across borders every year, 79% are women and girls who are often raped, often drugged, assaulted or threatened with violence. Do we need to have more Boysens? Do we need to have more young girls die before we commit ourselves to eliminating gender-based violence? How do we prevent gender-based violence as a health sector?
I give the floor now to the distinguished representative of Nigeria.
Like his counterparts from other countries, Nigeria's Minister of Health makes his contribution.
In many parts of the world today, the health challenges posed by conflicts and terrorism have become more obvious. And there is the need really for the World Health Organization to assist countries, including Nigeria, to develop and or reinforce strategies and their implementation for the management of victims and their relatives.
For 5 days, issues surrounding climate change and health, life-saving commodities, essential medicines, among others, came to the fore. Some of the delegates from Nigeria share country efforts at addressing some of these issues.
There were many issues in the speech of the DG of the WHO that concerns NAFDAC First and foremost, she talked about growing resistance to antimicrobial drugs. This is an area that NAFDAC is actively working on. She talks about increased access to good quality medicines for management of public health programs. Also, this is an area that NAFDAC is working on. Of course, she talked about reduction in maternal mortality and childhood mortality. This is also an area that NAFDAC is actively participating in the 1 Million Lives initiatives. This comes under the United Nations Commission for Life-Saving Commodities for Women and Children. 13 commodities were identified. These include some antibiotics, dispersible amoxicillin tablets, like chlorhexidine for management of cord care. Then there are some other like anti-diarrhea medications, zinc sulfate, medicines for management of postpartum hemorrhage, like misoprostol. So most of these drugs, we have plans to start making them very soon. Some of them have even passed very high quality standards. Some of the companies are undergoing WHO pre-qualification.
We also able to discuss the progress Nigeria has made in terms of polio eradication with Melinda Gates, the co-chair of the Bill and Melinda Gates Foundation, and they acknowledge the unprecedented progress we've made as a country in terms of exiting as a polio endemic country. As you are aware, the progress we've made in Nigeria this year is unprecedented in terms of polio eradication, which we're able to reduce the burden of our polio virus by 96%. So the global community is joining Nigeria, supporting Nigeria to take us to the last mile to ensure that we stop transmission of our polio virus.
The issue of climate change has featured this time around, announcing the type of threat it poses to the foundations of the human health. The truth about that is that there are a lot of activities that also impact on health that are human-related activities. So what it means is that the required alliances must have to be formed with other sectors. The environmental sector has been noted to be very, very relevant to whatever we may be planning at the health sector. So the required alliance, integration, collective planning will now be the order of the day.
At the end of the discussions, over 20 resolutions were approved by the 67th World Health Assembly. These include the need for countries to strengthen national action and international collaboration on how to reduce the level of antimicrobial resistance, and for member states to support research into new diagnostics and treatment options. Member states are also to work on strengthening the role of the health system in addressing gender-based violence, especially against women and girls and children. The resolution on health in post-2015 development agenda stressed the need for the conclusion of the unfinished work on health-related MDGs, which have to do with reducing child mortality, improving maternal health, and combating HIV/AIDS, malaria, and other diseases. Also, an increased focus on non-communicable diseases, mental health, neglected tropical diseases, as well as universal health coverage and improved access to essential medicines, among others. One of the events at the 67th World Health Assembly is the meeting hosted by Nigeria on neglected tropical diseases. The elimination of leprosy, onchocerciasis, dengue and severe fever, among other tropical diseases, formed the crux of discussions.
In our efforts to foster integrated planning and management, we have developed strategic implementation plans for NCD control for each of the 36 states and the Federal Capital Territory. Through this process, we have been able to further scale commitment of states as well as international and national donors, private, multinational corporations, to support both the NTD mapping surveys as well as program implementation. Currently, over 95% of targeted LGS have been mapped for hepatic filariasis, schistosomiasis, and soil-transmitted helminthes. 78 for trachoma. We have also further integrated our supply chain management system for the procurement, delivery, and distribution of medicines for preventive chemotherapy of NTDs.
In addition to what my Honorable Minister has said, in onchocerciasis, we are supposed to have a maximum coverage of 85%, but we have been able to do 76% of total population, and in LF, 60.5% as against 85%. For schistosomiasis, we have been able to do very little, just 27.5%, and our maximum coverage is 100%. For trachoma, our targeted coverage is 85%, and now we have been able to have 84%.
Neglected tropical diseases affect 1.4 billion of the world's poorest people through mortality, morbidity, disability, and stigma. NTDs are a key barrier to the attainment of the MDGs and poverty eradication.
I want to join the Minister and Dr. Bridget in appealing to the international community, our development partners, like you said, and others, to come more and help us. These disease conditions don't know any barrier. They are not for us alone. They are diseases that vectors can carry across our borders. And any of you or your relatives can visit those places.
Coming out of this meeting, control and elimination of NTDs will be more effective through the efforts and leadership of national governments, the integration of NTD programs with other health, water and sanitation and education initiatives, as well as coordinated and increased funding. After the break, I'll be speaking with Nigeria's Minister of Health on the country's efforts at tackling health challenges. Just stay with us.